Just for 30 seconds, gently breathing in and out, connecting your mind and body together. Excellent. Now, sitting in Gland Mudra, roll your shoulder back straight, head up, eyes closed. We'll take a deep breath and chant Om for 3 times. Gently take your both hands up in the air, rub them together, at least for 20 seconds, trying to generate enough heat between the palm of your hand. And then cover your face with it. Open your eyes between the closed palm of your hand. Feel the heat. When the hands cool down to body temperature, gently massage over your face, your head, your neck, your arms, and your body. To bring the body in your active state to get the maximum benefit of pranayama. Today, if I'm continuing through it, then I'll be focusing more on exercise. So first the body needs the energy. So let's sit in the Gyan Mudra, back straight, take a deep breath. In Khichdi Mudra, 2.5 seconds to breathe in and 2.5 seconds to breathe out for 3 minutes. Keep doing it. Bhastrika is one of the main pranayama to increase the level of oxygen in your blood. And second is to help to control your emotion, your anger, fear, anxiety, depression, and your soul calm down. Stress is one of the biggest cause of illness. The rest of the benefit is pranayama is help to control your body temperature, balances your good hormones, internal organ exercise, so all the toxins are eradicated, so organ can perform an optimum task to promote health. As the saying goes, highly clean body is highly immune body. The immunity improves to fight infection, bacterial or virus, Also helps to remove any toxin from your body. Also remove your body cells are dying, new cells are being born. The dead cell need to remove quickly. That's one of the main job for immune system to do that. That helps prevention of, keeps the body in balance and prevent prevention of cancer. And last a lot, as I said, help to control your emotion, anger, fear, anxiety, to reduce your stress. Between body and mind, breath is the brace, which helps you to control your mind, connect with your soul, which all lead to spirituality. Breath is the main vehicle for prana to enter your body. Everything in the universe is moving, alive, due to prana. If prana was there in the body, body dies, perishes. And breath is the main vehicle for prana to enter your body. People who learn to breathe properly, deeper breath, they remain healthy. They don't become ill. Gives you more oxygenated blood. Even it's been proven, even cancer cell cannot thrive in oxygenated environment. So even if you had cancer, if you do Bhastrika, deep breathing, longer hours, then cancer won't multiply, and ultimately they will be removed from the body and make you healthy again. And take your both hands up in there, rub them together. And so you've given managed to give your body the vitality, the energy. Your lung capacity increases by 30% during the practice of Bhastrika, deep breathing. But there's a lot of different kind of Bhastrika you can do. But we're dealing with people with certain age who are young at heart, but still age catching up with them. So you can't breathe. You have to do gentle breathing. But if you're younger, there's a 3 speed you can do. You can do faster, you can do slower. You can do expand the lung if you're young and physically fit. And that's why we try to do lighter ones, like all the hand exercise, things like that, to expand the lung. That's what we do. Very important one next is the stress. When you have anxiety or stress, you breathe in and you breathe out. You do that to release anxiety. So today we're going to breathe in and breathe out through your mouth, holding a straw, twice the length of breathing in. And for last time, excellent. Another way to release your anxiety and to increase your immunity as well, to activate the thymus gland. Thymus gland, if you put your hand in the middle of the chest, if you come down, there's a wee hollow bit there. That's where the thymus gland is. You should put your both hands there, you can tap it there, or you can put a pressure on it and do Kapalbhati for 30 seconds. That helps to activate your thymus gland and increase your immunity. Also helps to exercise your heart, so your heart muscle becomes stronger. So you get a lot of benefit just by doing this exercise and Kapalbhati. People with palpitation, and so on, missing a beat in the heart, all this will improve just by doing this. One thing I'll tell you today, a lot of people, when you do Kapalbhati, the blood pressure rises. If you have very high blood pressure, the way you should do it is like you breathe out forcefully, but gently breathe in as well. So the automatically you create a suction, the air goes in faster. Like then the blood pressure won't rise. You breathe out like Kapalbhati you do, but gently just try to breathe in gently. That's something I've tried, and that's why a lot of people teach that as well. When I went to USA, that's what they were teaching, to do Kapalbhati with gentle breathing and to help to manage your blood pressure better. And just a hint, if it works for you, good. Otherwise, just do the normal Kapalbhati, which we do regularly anyway. So next, we're going to do a very important one is the clearing your plaque artery deposit in your blood vessel, and also clearing any mucus in the lung. So by breathing in 3 times deeply, this time you breathe in and cough loudly for 3 to 4 times. Stay down for a few seconds. Once more. Excellent. Next, we're going to do some tongue exercise to activate the biggest nerve. Very good for any problem in your face, hearing problem, sinus problem, and by activating the biggest nerve, and also the thyroid gland as well. So first, do the tongue exercise. Take your tongue out and try to touch your nose with it. Hold it for 5 to 10 seconds until you do every day. Ultimately, your tongue will be able to touch the nose. Excellent. Next, take your tongue out and sway it right, left, right, left. You want to stretch it much higher you can. That way, you make the muscle back of the tongue stronger, so you don't have a sleep apnea or snoring. Snoring is when the back of the tongue starts flapping, and sleep apnea when that closes the valve, so it get lack of oxygen, and you can also faint as well. So that's why people sometimes are given a mask to breathe in and out when they have a sleep apnea. But excellent, well done. Next, take your tongue out, hold it for a few seconds and suck it back in. Last time. Excellent. Next, for the double chin, take your chin up, take your tongue out and take it up the way. Hold it for 5 to 10 seconds if you can. If you have a double chin, do that 5 times morning and evening daily. Then turn right. Then left. Repeat that once more, front again. Right. Excellent. Next, we make a sound like a parpatiya. Take a deep breath in with your lips. That itself activates opens up all the blood vessels around your face. The blood can flow faster. It gives a bit of glow on your face as well. The whole lip from here to here should be flapping, not just the small stuff. It's not just the sound, it's a whole flap. That's what activates the whole facial muscle. Excellent. Okay. That's itself able to activate the whole thing. A lot of people are asking about Khichdi Mudra again. It's very important. When you open your mouth, take your tongue out, and the tip of the tongue, you touch the roof as far back as you can. That itself activates your master gland, pituitary gland, which is able to slow down your heart rate, your blood pressure goes down, and body goes, and your breath goes from 18 breaths per second to 12 or less. So body goes in a state of calmness, and your cortisol in the body is reduced, and the stress reduced, and the body becomes in more. So if you're doing a lot of exercise, body goes to sympathetic nerve system, where you have a lot of cortisol being released. So once you do pranayama, that able to calm the mind down, and Khichdi Mudra helps to do that. Just by rolling up. So even when you're doing meditation, if you're doing Khichdi Mudra, then easy for mind not to wander, mind to go within yourself to find who you are, what's the purpose of life, and what are you doing with yourself. It's very important to find the God within you. Once you find the God within you, you know same God is just in all of you. And then there won't be any fight, any kind of problem in the world if people realize that. People always find good in themselves and bad in others. And Swami says, always dusro mein achhai dekho, apne mein burai dekho. Then you will realize and you try to correct yourself and you'll become a better person. So we've done the face exercise. Next we're going to do the nitric oxide exercise. Take your glasses off. Take your thumb to close your earlobe. But it's very important how you do it. If you close your palm, it's there, so there's no sound coming from it at all. And put your tongue again. But you'll get much better response of nitric oxide if it's just say Om, Om, karke muh band kar. Just the sound, start with Om and close your mouth and put your tongue in the teeth. Then vibration will be louder around the nasal passage to produce more nitric oxide. Om. 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 Excellent. Did you feel the vibration was bigger by chanting Om? When you do the Om and close your mouth, then the vibration is louder and more nitric oxide is produced in nasal passage. It's simple, but problem is when you're doing to the general public, some are all different faith and religion, so they don't want to chant Om. That's why we just say bumblebee. That's what keeps it everybody in harmony. That's the main purpose behind it. So let's all stand up now. We've been sitting for some time. So we'll do some nitric oxide exercise, please. And then I can see so Dr. Kapur is back. So after that, I would like Dr. Kapur to take over the class. Is that okay, Dr. Kapur? I'll highlight you as well. So let's start. Muskurai pale, haste pale, give me a big laughter again. Ah, 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 ah. तो यही है, हंसते में मरो सबको, है कि नहीं? Just मुस्कुराते रहो. That's Kapur ki nice hand exercise. Just nicely move through. Do whatever you can. Just get a movement, get a flexibility. Do some dancing. Oh, yes, this is so much like do whatever you can. Just laugh it off. Yes. Now let's start the nitric oxide. एक बार तो करना ही पड़ेगा. Listen to your body, very important. Breathing in and breathing out is more important than counting. I see Dr. Kapur is very active today, very energetic today. They're putting me to shame. Next now, dead man exercise now. Excellent. Now, dead man start jump. And nothing moves apart from your hand. Again, take a couple of deep breaths again. Excellent. Now ready to the next part. Excellent. Well done. Just shake your body up, hands are so, no problem. All your body, just like a big dancing movement. Yes, excellent. Well done, Dr. Kapur. Lovely movement you have there. Excellent. Next, put your both hands there. We take out. Excellent. That was round one. Just to break up, just put your hand in the front, just twist round. Other one is you can exercise, put your hand there, leg apart, and go. Your knee and different muscle exercise, just breathing. It's a smile. For 5 minutes. No, I'm kidding you. Let's go. Again, second round now. Excellent. Now dead man walk. Excellent. Now the dead man star jump. Excellent. Last one. Now give you a break, shake again your hand. Let's do some exercise. Let's breathe in and breathe out. Excellent. Now just take a hand right. And do the reverse. Last one, take it around the circle. And do the reverse. Next, put your both hand there, make a round circle. And reverse. You must have sort of forgotten all these exercises. I haven't. I'm just trying to mix and match. Play like a spaghetti junction. Mix everything together. Excellent. Next, we go into the last round of nitric oxide exercise. Next, the dead man walk. Excellent. Now, do the star jump. Nice and gentle. Listen to the body. If you're tired, just take a rest for a few seconds and start again. You can see Dr. Kapur is a good example of doing yoga, made her remain healthy longer. Otherwise, you have a lot of health issues. Because she's doing yoga, she managed to keep your movement, mobility much better than anybody else. If she didn't do yoga, it would be a different story. I can guarantee. So obviously, she knows the benefit of yoga and she's doing it full-heartedly. Now let's go into this one. Last one. What happened is, I took a class in Los Angeles. There were 60 people in the class training. 40 were doctors. I asked somebody to light the candle. I was only 1 or 2 doctors. There were 40 doctors stood up. The doctor believe in what they prescribe. It's not healing them. It's just managing the system. So they're looking for something else to heal themselves. And they're connecting with Ramdev and other people, yoga teachers, to connect with through yoga, trying to promote their health. That's very important. So, now, consider in a second now. Just take some rest. So, Dr. Kapur, are you ready to start the class? Are you all ready to take the class? Are you okay, or you want me to still do it? It's up to you.
Thank you, Shamanji. You want me to carry on with various...
Yes, you carry on. You carry on now. You take, sorry. Yeah,
let's first
I
cool down ourselves.
I put in the spot.
Let's first cool down ourselves. Keep your hand in Dhyan Mudra. Lift up your spine. Go on breathing from the nostril, slowly and deeply. We want to come back to normal, our heart rate and respiratory rate. You have done a lot of cardiac work today, which is very good for the muscles and the joints and the bones. This is the easy way to improve your bones mass, the muscles and the joints. Think positive and pat yourself. I have done very well. I have done very well with the blessing of Almighty and my Guru, Swami Ramdev Ji Maharaj. This is all due to blessing, nothing more. Carry on. Now you have done a lot of exercise for your neck and the arms and expansion of your chest, good for your heart. Let's concentrate now on our lower limbs. Lower limbs are always missed, you know. More concentration is on our upper part of the body. First of all, it's good to take off your socks, if you can manage, so that there's good movements of our toes, which we are going to activate. Try to squeeze your toes. And with this, our pranayama is going on, the Bhadraka pranayama. Breathing in and out at your own pace. Either you are doing slow or medium. And please, on the Zoom, my humble request, don't do it fast. Many of us are watching Swami Ramdev Ji. No, we are not supposed to do that, especially on the Zoom. Squeeze your toes nicely. Breathe in and breathe out. Full concentration is on my breath. Carry on. Squeeze them nicely, nicely. So take away any pain or discomfort in the toes. This is going to increase my sensations also. Well done. And if you can't do it, ask someone to do it for you. Like doing your toes up and down. In case you've got wrist problem, ask someone to do it for you. Then the big toe, up and down. Then rotate your ankle. You can always tailor according to your physical conditions. Sitting on the chair, even lying down in the bed, you can do it. That's what I do in the morning when I'm getting up. Clockwise, anti-clockwise. First do it very slowly, then increase. Carry on. Very good. Other one now. All the toes. Move them up and down. Very nicely. The big toe. Then rotate your ankle clockwise, anti-clockwise. Very good. You're doing well. Very good. Now, as the feet is up, do your channels also. There are 4 channels. and the body here is represented opposite. So I am going to get better with my sciatica on the right side. I am doing the left foot. Sciatica, knee pain, hip pain. Do all the channels. They are the soft area in between these bones, known as tarsal bones. 1, 2, 3, and 4. Do them nicely. That's what we do after bath. Put oil or cream, give them nice massage, lubrication. Carry on. Then you can do your soul. Whole body is there, like at the hand, Our eyes, give a nice pressure on that. Acupressure. The eye point, the ear point, the lung point, the kidney point, the pancreas, and on the right side is your liver and the gallbladder. Coming to the right kidney, adrenal. Lower part is your colon, intestine, and down here your sciatic nerve. So you go on pressing, even if you don't remember where my organs are, just go on. You will get hold of something. Very good. Very good. Now you are relaxed, quite well relaxed. The same thing is done on the left foot. In front, all these 4 channels to get rid of sciatica, knee pain, hip pain, ankle pain even. And same thing again, you are doing your acupressure point on the left foot. Carry on. You can do with knuckles. Or you can do with a pencil. There is this acupressure pencil, also wooden pencil. You can do with that. Or if you haven't got, nowadays we have got so many things available in the market. Like I do my acupressure with these things. See? You are sitting, watching television, talking to your friend. Just go on doing this. See, they are very handy, these things. Acupressure. So you are doing your acupressure, activating, increasing the circulation, increase the oxygen, get rid of any pain. Oxygen is pain killer. Carry on like this. And then you're quite active. Now you start doing more. And we were doing at a medium speed now. Up and down. Follow your own body. Do it slowly if you've got problems. Up and down, up and down, up and down. Then join them, rotate clockwise, anti-clockwise. Very good, very good. Be gentle yourself. Again, follow the policy of Swami Ramdev Ji. Do every movement for a long time, not just rush over, rush. Rush is not you. Do this maybe 10 times, 20 times, 30 times, 40 times. Then only. And keep in mind your breath. The pranayama is side by side. No rushing in yoga. Do few asanas or exercise, but do it for a long time. Because our muscles and joints, they take time to sleep. They are sleeping most of the time. They want to get up slowly and slowly, warming up. Very good. Well done. Again, you can hold it like this also you can do. You're quite active now. Do at medium speed or slow speed. Or maybe some of you can do fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. At your own pace. Don't worry about counting. Keep the mind on the breath. Breathe in, breathe out. Breathe in, breathe out. That's the idea. Well done. You're quite active now. Now hold your foot like this. Try to bring your knee close to your chest. Keep in mind the backache. Sit still and just pull up your knee close to your chest. Squeeze your stomach. Get rid of any wind, the constipation, activation of the internal organs. And pull it down gently, no pressure. Especially at this age, you might break your bones if you're too hasty. Be very careful. Up again. Hold it. How long to hold? Maybe 30 seconds, 40 seconds, 50 seconds. Or at home, you can do for 1 minute. The longer you hold, the more benefits will come. Hold. Thank you. Push down. Now hold it like a baby. And rock the baby. Ah, ha, ha, did a good laughter. Ah, ha, ha, ha. Ah, ha, ha. Ah, ha, ha, ha. Well done. Relax. Relax. Take a couple of deep breaths in and out. We do yoga for relaxation, to change us completely, total transformation. What is a rush? What is a rush? Now, get hold of your left knee. Try to bring close to your nose. Keep in mind the backache. Hold it again. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Hold it. Throw away the wind from the abdomen, which is giving us so much problem. Press hard. Your thighs are pressing all the internal organs. Then take it down slowly. And then you can do like this. Bring it again. Down. Up. Carry on. And down. Then you can hold like a baby. Rock the baby. Ah, 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 ah. Well done. Well done. Sing nice things for the baby. Love your baby. Well done. Take it down now. Now, slowly and slowly, our legs are well relaxed now, isn't it? No rush. No rush. Be gentle to yourself. Now, you can hold at the back or give massage before that, because most of us are suffering from knee problem, isn't it? Give a nice massage with a smile on the face. I love my knees. My knees are getting better every day. Every day. And squeeze them nicely. And give a lot of pressure from the back. These are the areas, especially the medial size, which give us a lot of problem. You might have noticed that if you're suffering. Nice. Before going to bed, always do some massage on the knees. Always. The feet also, to get nice sleep. Even I put mustard oil in my umbilicus. 72,000 nerves are attached there. This is the main source where we get the food from our mother when we are in the womb. Put oil, any oil, mustard oil, sesame seed oil, coconut oil, whatever, or ghee even. Nicely put in the umbilicus. Give gentle massage on around your umbilicus. You are activating your Manipur chakra, which is controlling all the systems of the abdomen. Clockwise, anti-clockwise, and put in the nostril also. Start with the nostril, the umbilicus, then do your legs. This is before going to bed. And do the feet also. At the sole. Nice. Give them enough oil, not dry. We want with the lubrication, cream or oil, whatever is available, or the ghee. Get nice sleep, ready for the next day. Well done. So hold your legs like this. Now here I am just doing about 30 degrees. Just lifting up, very gentle to my knee, 30 degrees. And when we lie down and do this pose, we call it Uttan Padasana. Yes? These asanas are very good for the problem in the stomach. Those 5 asanas, everybody knows. So I'm just doing, sitting on the chair, my Uttan Padasana and holding it now. This is Uttan Padasana. 30 degree holding. Hold. Go on breathing in and out. From the nostril, mouth is closed. Hold it, hold it. 10 seconds, 20, 30, 40. Then take it down gently. Same thing again, I want to loosen my knee first. Do it like this, swinging. Do it as long as you feel comfortable or getting more relaxation at your knee. Then you lift it up 30 degrees again. Uttan Padasana while sitting. Keep your neck straight, spine straight. No bending forward or backward. Just straight. Love your back. Hold it. Then take it down while exhaling. Now breathe in. Take the both feet up. 30 degrees only. 30 degrees. Uttan Padasana while I'm sitting on the chair. So we can do about 95% of the exercise while sitting on the chair. Never feel like I can't do it. I can't. You can do it. You can do in the bed also. Hold on, hold on. Well done. You're doing well. Hold it. And take it down. Lovely. Very slowly. Very good. Now you can go up now as the knees are more relaxed. 190 degrees. Hold. When you're lying down, you're doing this. Hold 90 degrees. The toes are facing the ceiling. Stretch. Stretch. Feel the pressure on your calf muscles and the hamstring, the back muscle of your knee joint. These are holding our knee, you know. That's how the knee is getting better by doing this exercise. Hold, hold, and get rid of extra fat from the lower limb. Hold. Again, hold for a long time. Not just 1, 2, 3. No. Carry on long time. At home, you can do 1 minute, even 2 minutes. One posture. Then breathe out. Take it down very gently. Time doesn't permit, that's why I'm just doing maybe 10 seconds. But please try to do longer, longer. Breathe in. Hold it at the back. Stretch. Toes are facing the ceiling. Yes. Give a smile on the face. Close your eyes and feel where the effect is coming. At your calf muscles, the back of your muscles of your thighs. So this calf muscle is getting activated, increasing my lymphatic system to fight against any viruses. Increase the immunity. Take away the cramps, the varicose veins, swelling of the legs. Simple exercise. So you can do both together. Be careful sitting on the chair. Do as much your body allows you. Hold it. Hold. 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 Toes are facing the ceiling again. Even you can do with the arms also the same exercises. But I think we have done enough in the beginning. Don't overdo it. Take it down. Very good. Now you can do it at fast speed now. Follow your own body. 1. Breathe in and out. Carry on. Carry on. Carry on. Carry on. Carry on. Other one. Carry on. Carry on. Carry on. Carry on. The next one is rotation now. Hold it at the back. Circle. 360 degree. As what we are doing while lying down also. Clockwise, then anti-clockwise. And repeat this 20, 30, 40 times. One side. The longer you do it, the more effect will come. One. Go on breathing. Don't worry about counting. Breathe in and breathe out. Then you want to do your cycling. So easy. My foot is solely on my pedal. Carry on. Going forward. Very good. Very good. Very good. Going back now. Reverse gear. Other one. Going forward. Go down, right down and come up. Remember? Cycle. Down and then up. Down and then up. This is very good for the knee joint and getting rid of fat from the legs. Exercise, good exercise. Anybody can do it. Then reverse gear. Well done. Carry on. Carry on. Carry on. Carry on. Enough. Just relax. Don't overdo it. I love my body. Just relax again. Breathe in from the nostril, exhaling from the mouth. Well done, ready again. Are you ready? Now let's start with our Chakrasana. Follow your body, don't bend forward. If there's heart problem, hypertension, low blood pressure, backache, osteoporosis, keep in mind always at this golden age our osteoporosis. Keep in mind that. Carry on. Carry on with the music. Carry on. 50 times, 50 times. Carry on. जिसे पहन झांसी की रानी बिक गई अपनी आन पे आज उसी को पहन के निकला आज उसी को पहन के निकला हम मस्तों का डोला मेरा रंग दे बसंती चोला मेरा रंग दे बसंती चोला मेरा रंग दे बसंती चोला रंग दे बसंती चोला रंग दे बसंती चोला इस देश का तेरे बस इतना अरमान है हम निकले इस देश का तेरे बस इतना अरमान है एक बार इस राह पे मरना 100 जन्मों के समान है देख के वीरों की कुर्बानी देख के वीरों की कुर्बानी अपना दिल ले डोला मेरा रंग दे बसंती चोला मेरा रंग दे बसंती चोला मेरा रंग दे बसंती चोला रंग दे बसंती चोला रंग दे बसंती चोला 8 बसंती चोला मेरा रंग दे बसंती चोला 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 Carry on, carry on. Stand up now, please. Follow your body. Follow all the precautions. Do as much your body allows you. Watch out yourself. Breathing out when you're going down, breathing in when you're coming up. Keep in mind your own hypertension, heart problems, severe acidity, severe asthma, severe backache, osteopenia, osteoporosis. Please, please, please. So watch yourself. Let's start with Tarasan. Spread your legs, arms at the shoulder level and stretch them, stretch. And take it up, up, stretch again. Very good. For the weight reduction, for the digestive system, and in children for the height. Then bring your hands down, go up again. We are standing our 4th foot, heels are up. Stretch. Now try to stay at least for 20 seconds. At home you can do 30, 40, 50, maybe 1 minute or 2 minutes. Then only the benefits come. Carry on with a smile. Very good for the spine. Carry on. Carry on. I can see you. Let's see who does for longer time. You will get gift. What gift? In the class, we used to tempt at them with the samosas, you know. Just joking. No samosa in the class. Only on festival, when we celebrate some festivals. Carry on. Carry on. You're doing well. Stretch yourself. Then breathe out. Come back. Feet are on the ground. Hands are going up again. And here we're doing bending, which is very good, known as twist pose. Right bend, very slowly. Follow your own body. Even if you're hypertensive or having low blood pressure, please watch out. Watch out for these things. Go down more. You're doing well. Stay there for a short time. Get rid of all the fat from the waist. Kamar patli karane ka best tarika. Up again, breathing in. Stretch. Breathe in. While breathing out from the nostril, going toward the left side, left bend. And you are activating most of the body parts. Your chest, your heart is getting active, your lungs, abdominal organs. I am having left bend, so I am activating my liver, the gallbladder, some part of the intestine, pancreas. Even the effect is going up to the reproductive system. Carry on, carry on. Then breathe in, come up very slowly. Next is Kati Chakrasana. Hands in front. The distance is shoulder width. Stretch, again stretch. Take it on the right side. Again we are bending. Go right back as per your body allows you. Don't overdo it. Always, if there's a problem with the back, please don't do any twist of the spine. Then breathing out, coming in front. Breathe in, go towards the left side. The neck is also moving. Any neck movement is going to activate my thyroid gland, parathyroid gland. And the thyroid gland is the one which is responsible for the metabolism. So this is a very good way to activate the thyroid gland and get the activation and balance your weight. Then come in front slowly. Well done. Other one you can do like this again. At your own pace. Slow, medium, or fast. And you are so active now. Well done. Well done, Javano. We are all young. Age is a number. Who bothers? Carry on, the whole body. I want to wear sari. So the blouse will show my waist. Come on, come on. Be happy. Be happy. Now the next one is some poses for weight reduction plus for the back also. Known as half camel pose, as I can't do properly sitting down. Hands are at the buttocks. Small width between your feet. Breathe in and go back. Looking at the ceiling. Again, you are activating your thyroid gland, parathyroid gland to get rid of extra fat. Or if you're underweight, you'll put on some weight. That is the magic of yoga. Balancing. Stay there for 20 seconds, 30 seconds, maybe at home, 1 minute, 2 minutes, 3 minutes. As Swamiji says, every pose should be done for 5 to 10 minutes if you want to get better. Carry on. Then you breathe out. Now, while you're staying like this for a long time, you can go on breathing in and out. You should not hold your breath. Please, please. If you are hypertensive, heart patient, never hold your breath. This is very, very important. Especially at the moment with this COVID problem, many people are suffering from breathlessness. Please, please don't hold your breath. Only if you're perfectly healthy and very young at heart and age, then you can do it. So watch out, please. These are my precautions to you. Once again, we'll do it. Breathe in, take a long deep breath in, and take your head back. Hands are at the buttocks. Half camel pose. Ardha Ushtang Asana. Then you breathe out and look straight. Next one is half moon asana. Ardha Chakrasana, Ardha Chandrasana, Ardha Chandrasana. Again, breathe in. Take your head back. Then you breathe out, look straight, relax. Once again, breathe in, go back slowly, head, you are looking at the ceiling, stretching your neck, you are doing your neck exercises also. One pose is doing so many movements, giving the benefits. That's the beauty of this yoga. Not only one benefit, multiple benefits. Carry on. Plus, you are doing your eye movements also. Now look straight. Now next, I'm going to cover some mudras and some poses. Mainly, I will be focusing on the one which is going to activate my body, my thyroid gland, so that I get better. So the mudra I am going to use is, everybody remembers? Shank Mudra. Use a Shank Mudra. You are going to do Kapalbhati. Keep in mind all the precautions again. After major surgery, don't do 4 to 6 months. Even after minor surgery, get the advice of your yoga teacher or your physician. Any bleeding anywhere, any headache, any dizziness, please don't do it. Any headache for any reason, don't do it. During menstruation or we are pregnant, don't do it. If you're trying to get pregnant, even don't do it. So this is your Shank Mudra. And go on doing Kapalbhati. Time doesn't permit, so we'll doing only 10 times. At home, try to do for 1 minute, please. To activate the thyroid gland. At your own pace, 1 stroke, 1 second. Either slow speed or medium, don't do fast, please. Yoga is not fast. It's very soothing, medium or slow. And give a good smile. Take your mind to your thyroid glands. Give them vibration. Or even you can touch them. Touch. Healing on touching. So touch them. Thyroid gland. And request them, please get better. I want to lose weight with love and affection. The next mudra, which is very strong mudra, as you know, the Surya Mudra. That is going to activate all the organs, increasing the heat in the body, as the name says, sun, Surya Bhagwan, Suryaya Namah, Shri Suryaya Namah. And go on chanting the Pratna inside, Surya Bhagwan ki, jo bhi aapko aati hai. Go on chanting and do Surya Mudra. This is going to increase the heat in the body, As you know, when the temperature is low, we feel very depressed and we don't want to do anything. So we are going to activate our all system, even the thyroid gland, get better with the cholesterol levels, the liver, the diabetes. And we are happy also. When we don't see the sun, we feel depressed. Blueness is there. When sun is there, we are cheerful. We want to do everything. The next mudra is your Linga Mudra. Increasing the heat in the body. Good for people suffering from low blood pressure. Everybody knows. Linga Mudra. Even with exercises, we are now started doing mudras. Get extra benefit. Well done. So these mudras I have covered to increase our metabolism. And the next one is your now pranayama. Pranayama. Most of the steps are going to help us, but out of these we will say, wherever you are doing your neck movement, you are getting the benefit. That pranayama is your, which one? Bahari pranayama, where you do 3 locks. This is not for everyone, my dear friends. This comes with the practice, and best thing is if you are not used to do it, don't do it. I humbly request you. Because even in the classes when we started 15 years ago, we waited for 6 months to start doing it under observation. In this, we do 3 bands. As you know, Jalandhar band, when the neck lock is there, you are activating your thyroid gland, parathyroid gland. So this is very, very important. Bringing your neck down. Neck down is very important. The rest of the bands are also important. Udyan band is very good for all these organs of the abdomen. As this is central government is getting a lot of pressure. And then Mool band. That is again very good for the problem down below. At this lovely age, what we are getting? Prolapse. Uterine prolapse. Descent of bladder also. And urinary problems. Too much urinary infection. And frequency of micturition, going to toilet again and again. And plus leakage down below. Incontinence, fecal and urinary incontinence. So this is the best one. We should practice this more and more. So this one, we will just do just once only to demonstrate all this. Hands are in Vajramudra. This is also very strong mudra. For any pain anywhere, joints or headache or whatever, cramps, plus for the digestive system. We should practice this every day. Maybe 45 minutes because our Jatra Agni is disappearing of the age problem. So activate our Jatra Agni to digest the food. Try to do Vayu Mudra every day. 45 minutes, 10 to 15 minutes round 3 times. And let's just do once only Bahari Pranayama. Again, heart problem, hypertension, or any pain in your abdomen, please don't do it. Okay? Hands are in Dhyan Mudra, in Vayu Mudra. Breathe in from the nostril. Long deep breath in, slowly, deep. Then exhale fully. Exhale fully. Then you make first this, the root lock, as if you want to go to toilet and the phone is ringing. You squeeze yourself. The muscle below the navel, you squeeze them. The levator muscles are there. All organs are sitting on that. So you're lifting them. This is known well for pelvic floor exercises. So do that first. Udyan Bandh automatically come when you exhale. Then bring your chin close to the chest if there's no neck ache. Now here, if you are perfectly healthy, you can hold your breath. How long to hold depends upon your practice. Don't push yourself. Bring your chin just close to the chest. I'm activating my thyroid gland, parathyroid gland, vocal cords. Hold it, can't hold anymore. Then breathe in, raise your chin up, look straight. And when you do the more practice, then we say, otherwise, don't worry, you can open anyone. Then they say you open up first the neck lock, Udyan Bandh, and then the Mool Bandh. But this is not a must for everyone. Only when you are practicing more and more. Because we want to hold on more on our Mool Bandh, the root lock we want to hold for long. Because there's so many benefits coming down there. So if you can't do others, just do this Mool Bandh every day. Try to do 5 times, morning, evening, and you will see the difference. At this age, there's lots of problems which we don't talk. We are very shy. So please focus on that every day. And then you can do Agni Sara also. That is increasing your metabolism, of course. Again, how long to do it? Procedure is same, breathe in, breathe out fully. Then you go on pushing your stomach forward and backward. More overweight, you have to do maybe 100 times, 500 times. But don't do in the beginning. The beginning do 5 times, 10 times, 15 times. Slowly, slowly, slowly build it up. So this is very important for weight reduction. The next one is Ujjayi Pranayama. This is the best one to activate my thyroid gland, parathyroid gland. Again, procedure is very, very important here. Hands are in Vajramudra. Squeeze your neck muscles. Put your hand here at the dimple here. See, the work is happening here, not in the nose. Here. Now breathe in. Now you can do, if you're practicing for a long time, do your Nitric Mudra. That is going to give you extra benefit. So as Shravanji already explained this morning, but this is a very good mudra with Ujjayi Pranayama for the activation of thyroid gland, parathyroid gland. So breathe in. You can feel something is moving at the lower part of your neck, this dimple, the vocal cords. And the sound will come like snoring sound. Squeeze your neck muscle, breathe in from the nostril. The sound is like snoring sound. This is coming from here. In the beginning, do small, then you can increase. But don't get tense. Relax, relax, relax. Then bring your chin down if there's no neck problem. Hold it. Again, keep in mind precaution. No holding, hypertensive, heart problem, breathlessness. Hold it. How long depends upon your practice. Can't hold anymore. Straighten your chin, look straight, close your right nostril with the right thumb, exhale from the left. This is your Ujjayi. Best pranayama for the thyroid gland. So I've just covered those things which is, and other thing you all know. You can do next is your humming already we have done. So we will do Alom Vilom for very short time as time is running fast. Very good pranayama to balance ourselves. We are doing Surya Vedi and Chandra Vedi. balancing in every way. Our vyavahar, how we behave, our eating habits, our dressing habit, everything is controlled. Get rid of extra fluid from the body, production of good hormones, making us so happy and cheerful, taking us toward the state of samadhi, antarmukhi. Me, my soul, and my super soul, nothing else. Carry on. Let's move over to Bhamri 3 times, followed by Geet and then Pranav. Bhamri Pranayam 3 times. The 8th step known as Pranav Pranayam. We are in the seat of silent meditation. Fix your mind either on your breath or the third eye, the Agya Chakra. Go on chanting the Lord's name inside, whatever you practice at home. Any name, any Shabad, any dhun. We are in the state of gratitude also. I am never alone. Please repeat inside, I am never alone. I am never alone. The Supreme Power is always with me. He shows us the path, how to serve the humanity. Give us the guidance. We are thankful to Almighty who gave us strength to perform today's yoga. Thank you, thank you, thank you. Raise your arms up, rub your palms. Put the palm on your eyes. Feel the warmth going on your face. This is going to increase my vision also. Slowly open your eyes, remove the hand. Thank you. Next is your Singhasana, very important. Again, good for metabolism, increasing the thyroid gland, parathyroid gland, the vocal cord, get rid of all sinusitis, ear problem. 3 times we'll do it. Swallow your saliva, give a good massage. Next is easy way to get rid of fat and be happy and cheerful. The internal exercise, production of good hormones, endorphins. Be happy, be happy. You have done quite well. Be happy, be happy, be happy. thankful to God who give us strength, strength. Jai Ho. Carry on. Be happy. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, ma kaschit dukha bhag vivet. Om Purnamidam Purnat Purnmuchyate Purnasya Purmadhaya Purnameva Vishishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti. Thank you very much, my friends.
Thank you.
Thank you.
Thank you very much, Dr. Kapur. Thank you.
You're welcome.
Thank you, Dr. Kapur. That was very nice.
Very
Nice.
nice and relaxing.
Very nice, Dr. Kapur.
Thank you very
Very
much.
fantastic.
Nice and
Dr.
relaxing.
Kapur, very
Thank you
nice.
very much, Dr. Kapur.
Thank
Very
you
nice.
very much.
Class.
Thank you very much.
Somebody in
Enjoy
the
the
What about me? What about me?
Thank
Nobody said
you.
thank you to me.
Thank you, Shravanji. Shravanji as well.
आप पीछे चले गए
I know.
आप पीछे
We
चले गए
can't see you.
कपूर जी आप डॉक्टर हैं इसको बहुत अच्छी तरह से समझाते हैं
आपने तो हम मेरे जैसे यवान को भी शर्मा दिया, इतनी एनर्जी आपके पास है।
वही बोले
क्या
ये सब योगा का कमाल है।
योगा का कमाल।
योगा का कमाल।
श्रवण जी, आपका
Thank you very much.
दीजिए।
Bye.
Tomorrow के क्लास में we'll focus for half an hour meditation, like with peace in the mind. No talking at all. Just to find yourself, who you are, what's the purpose of life, what are you doing in this planet. Very important. हम लोग काम करते जा रहे हैं, क्यों कर रहे हैं पता नहीं, किसके लिए कर रहे हैं पता नहीं. Find that. Why you doing it? Who for?
We don't know either.
I know nobody knows that. Even I don't know.
Make sure you got something to cover yourself. Remember that. Yeah. Get
Don't
something to
forget
cover
I
something.
thought we all are covered up. No, nobody is naked. Everybody's covered up.
You need a
वो
shoulder
मेरा
or
माइंड
blanket.
नहीं था, लेकिन
I know.
बॉडी का टेम्परेचर थोड़ा कम होगा तो
Well,
आपको
that's it. No, I'm just kidding. I'm just putting your leg more. No problem. Just I like to always cover.
We know you like the jokes. You
Yeah.
like
Yeah.
it. So that's good. That's very good. Makes
वैसे
it lighter.
श्रवण जी आपकी बात सही है। वैसे हम जो आए वो जंगल में से बहुत सालों पुराने, सदियों पुराने आए हुए हैं। उससे बाद में तो अभी हम कपड़े
हम लोग नंगे आए थे, नंगे जाते हैं। स्वामी जी बोलते ना है, स्वामी जी क्या बोलते हैं कि ये हमको तुम लोग के सर में काहे कपड़ा पहने, हमको वो भी नहीं है। हमको याद है लास्ट टाइम, one time I was in Canada, America, doing training with Swami ji as well, Acupressure all that कर रहे थे। तो स्वामी जी ने हमको रूम को बताया अपना कहानी कैसे ऐसे, you have to be careful when you do Acupressure, always किसी को साथ लेके करो, नहीं तो हमको कितने लोग बदनाम कर दिए हैं, इसलिए you have to be careful who you do with, So he was trying to give me like a birds and a bees, all the story about how to manage it, things like that. We knew I was very vulnerable. Sometimes people misuse you, try to think differently, try kind of, because my nature is very, I'm like a country, I kind of come close to everybody very quickly. I'm not, I don't defend myself in a sense, The Swamiji trying to give me a lecture on half an hour lecture on how to manage this, your acupressure or yoga class to make sure I don't hurt anybody feeling and don't harm myself in the process. Thank you, Sheetal ji, everybody else. Thank you, Ajay. Hope you all
Thank you.
enjoyed.
Thank you,
Thank you,
everyone.
everyone. Bye bye.
आपका दिन पूरा खुशी में जाए, ऐसी प्रार्थना।
Ajay, bye, bye.
Anand Mangalam.
Anand Mangalam. आप लोग हंसिए, हमको तो गार्डन में जाके काम करना पड़ेगा, हमको तो घूमने जाना है।